Upper and lower eye lift. I am thinking of having lower and upper eye lift surgery. What age do you recommend to have this surgery? I am 45 years old. I currently suffer from dry eyes and glaucoma runs in my family. I currently see an eye doctor every 6 months. If I am prone to scarring, keloids, what could be done to avoid this? Thank you.
Thank you for your question. You submitted a photo of your eyes and you are asking about undergoing upper and lower eyelid surgery, and you're asking what age is best to do it. You state in your question that you're 45 years old, you have a history of dry eye and glaucoma, and that you go to an ophthalmologist every 6 months to have your eye pressure checked. You also have a history of issues with keloid scarring. And so I think that what you're basically looking for is just some guidance as to what to do and when to do this. Well, I can certainly give you my perspective as an oculofacial plastic surgeon. A little bit of background: I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years and dealing with issues where there's ocular issues as well as cosmetic issues is basically the focus area of my practice. So when assessing someone like yourself, we first start with, of course, asking about what are the key aesthetic issues that you're concerned about. When I look at your eyes, I notice a few things. First, looking at the upper eyelids, I notice that the right upper lid is a little bit lower than the left upper eyelid. Now, this may be just one angle of taking the photo, but if that's the case, it's something important to recognize that you may have a concurrent issue called eyelid ptosis. And eyelid ptosis means that the eyelid is drooping because typically of a muscle called the levator muscle. And that muscle is the muscle that's responsible for lifting the eyelid. Now, it doesn't mean that every time someone has a mild degree of ptosis that it needs to be addressed, but I feel it's always important to recognize it and to bring it to the patient's attention that it is present. So when you look at your upper lids, the question is, do you feel like you have too much skin in the upper eyelids, or does it feel like the upper eyelid is a little bit too droopy bilaterally or in both eyes? And I would tend to lean towards the latter. It doesn't look like you have a lot of skin over your eyes, but it does look like the upper lids are a little bit droopy. And that's something to consider on what is the best approach. Do we address the drooping of the eyelid from the muscle, or do we address additionally some of the skin? Now, it's very important when you consider eyelid surgery, especially when you have a history of dry eye, to prevent any risk or minimize the risk of ocular exposure. So the procedure has to be done with eye health in mind. This is such an important issue that I simply can't overstate it. So that being said, moving on to your lower eyelids. Lower eyelids, I see essentially some puffiness and possibly some sagging of the lower eyelid. And that issue can be dealt with. Typically what I would do is something called a lower eyelid transconjunctival blepharoplasty, which is to address the anatomic issue, which is the fat pockets that are under the eye, as well as possibly a lower eyelid tightening procedure in order to maintain the proper tone of the lower eyelid to allow proper tear film distribution over the eyes. Patients come to us from all over the world who have complications of eyelid surgery, such as eyelid retraction or exposure, and they need reconstruction in order to get proper functional process of their eyelid back in order. So it's something that I'm very attuned to, and especially when you have other ocular conditions, has to be, again, factored in when you discuss a surgical plan. Now, there are other procedures that are often done concurrently with eyelid surgery to help improve the maximal benefit, and this includes procedures such as use of platelet-rich plasma, or PRP, which is derived from your own blood and is a concentration of growth factors to help the skin quality improve. We also do things like fractional CO2 laser and erbium laser to improve skin quality. And to address the question, of course, about the keloid scarring, a lot of times people think of keloids because they have other areas of the body, such as, let's say, a C-section scar or an incision on their arm or somewhere in their abdomen that got thick, and they feel that they're a keloid former. Generally speaking, in my experience in over 20 years of practice and being someone who has always been attuned to the needs of different skin types and ethnicities, I would say that eyelid skin actually is remarkably forgiving, even in people who are at high risk of keloid forming. And so I think that there's a matter of proper management technique and minimizing the risk, and it's likely that you won't have an issue with keloid scarring. As far as the question about the age in which to do a procedure, it really doesn't, in my experience, it's kind of immaterial what the age is. We have treated people as young. My youngest patient for under eye bag surgery was 14 years old, and so far my oldest patient is in their 90s, and then we had one patient years ago who was actually over 100. And so it's actually a question of combination of aesthetics, functionality, and the need for these procedures as long as you are physically healthy. So it's important that you factor in the relative importance of the procedure and all the other ocular issues, and then do the procedure when you feel like it really will make an impact on your appearance. Clearly this is something that's bothering you, so obviously by presenting this question to us, I think that it is something that is important to you, but I think it's more important to actually understand all the variables that have to be factored in before you do any type of eyelid surgery. So I would recommend you meet with qualified, experienced cosmetic surgeons, and I think I would be more inclined to recommend an oculofacial plastic surgeon, and beyond that, someone who does a lot of cosmetic surgery. I think even a specialized field like oculofacial plastic surgery. There are colleagues who do a lot more reconstructive, and there are colleagues who do a lot more cosmetic. My practice, for example, is a practice where we do a lot of cosmetic surgery. So I think there's a different frequency in which people are tuned into when they do a lot of cosmetic versus doing a lot of reconstructive, excluding cosmetic. So it's just a matter of being comfortable with the doctor you choose. So I hope that was helpful. I wish you the best of luck, and thank you for your question.